tell you about how they say health is wealth. But if the common man does not have access to basic healthcare facilities, it reflects the poor state of medical infrastructure. Now, taking note of the same, the Delhi High Court has expressed serious concern over the lack of medical infrastructure in government hospitals for patients requiring critical care in the national capital. In fact, the court also sought accountability and directed the Delhi government to explain why the healthcare infrastructure is not keeping pace with the rising demand. Furthermore, the High Court has asked the Delhi government to file a status report giving details of the amount it has spent on strengthening the health sector in the last 5 years. Now, the bench was informed about an incident on the intervening night of January 2nd 3rd when a man who jumped out of a moving police control van died after being denied treatment by 4 government hospitals. In fact, in December, a 14-year-old girl died tragically after reportedly being denied a bed in 3 hospitals: AIIMS, Safdarjung Hospital, and Delhi State Cancer Institute. Rame, my colleague, joins me for the latest on this. Rame, clearly, of course, the High Court is seeking accountability. But just to draw things into perspective for our viewers, this was also being heard at the time where PILs were being heard. So what are the key directives and takeaways that we should know about?
So yes, the acting bench of Chief Justice of the Delhi High Court yesterday questioned the Delhi government on the insufficient medical infrastructure in the state. The acting Chief Justice right away questioned the Delhi government that why the city's hospitals have not kept pace with the growing city's population. The city's population has been growing since indefinite period, and why these hospitals are still having these limited number of beds. That was the first question put by the Delhi High Court. The acting Chief Justice also directed the Delhi government to file a status report indicating what amount has been augmented to the health sector in the past 5 years. They have asked for a status report. They have also directed the Delhi government to tell that whether they are working on the live portal which shows the availability of beds in the Delhi across all hospitals, to come on a live tracking portals where it could be shown that how many beds are available and in which hospital. They have sought the status report on all such kind of things. Let me tell you, a Delhi High Court was dealing with a suo motu petition, and an application was filed by Advocate Ashok Agarwal, who's also acting as an amicus curiae to the court. So he had stated that a man on the early morning of January 3rd died after jumping from a PCR van. He was hurt and he was taken to 4 hospitals. Out of these 4 hospitals, 3 were the state government hospitals and 1 was the central government hospital. First hospital denied treatment on the non-availability of CT scan. Like, it's unimaginable that a Delhi government hospital does not have the basic facility of
Right.
CT scan, and that patient was refused. So the court has also remarked
Right,
that
Rame. Although you're
are
getting
the
us those important details and drawing things into perspective, I'm afraid I'd have to interject you there because we're running short of time. But thank you very much for helping our viewers better understand what the directive from the High Court has been.